We're on Facebook and Twitter with our post-show, continuing our discussion about tonight's topic, racism, the real public health crisis. I just want to say off the top that Dr. Northington Gamble had a heart out because she had to go teach a class. But I'm still joined by Jean-Luc Parit, Thea James, Dr. Thea James, and Boston City Councilor Ricardo Arroyo. Let me start with you, Councilman Arroyo, because if you're able to successfully get this office modeled on, let's say, the one in Milwaukee, what exactly would it look like? Like, who would be not supervising, but I mean, who would oversee it, I guess, and how would it interact with other departments in the city? And what would be the number one thing you would want that office to do? Concretely.
I want them to have independence. And so the idea would be to have it be an independent body, similar to the Congressional Budget Office. If I created legislation, I'd send it to that office. That office would analyze that legislation and would say, hey, this legislation actually has the impact of raising racial inequities. It actually lifts racial inequities up. It doesn't decrease them. Or alternatively, this decreases racial inequity, or this has no impact on racial inequity, because you can measure those things and you can measure the impact of those things the same way you can measure budget, the same way you can measure the spending on this is going to go up if we do this, or the spending on this will lead to a decrease in funds if you do it this way. And so this office would analyze those things. It would make it public. It would be public facing. So it would say, I'll give you an example. We did a small business relief fund. That small business relief fund, in the guidelines, in the rhetoric, in the way to get in, the determinants on how you got accepted, would go to this office. They'd come back and say, hey, look, you're asking for this. This is not something that historically Black and Latino communities would be able to answer. And so by doing that, you're increasing racial inequity, right? Or it would say, this is well written. This actually takes care of that. So things like that would start to be implemented. And what it would do is, when somebody like me, who cares very deeply about racial inequity, writes something, I take it at heart. I have my team look at it. We study it. But other folks don't do that. And this would force them to have a check on that, where they would, if they did their policy and they sent it to them, they would say, hey, look, this obviously wasn't a part of what you were thinking about. And it shows because it increases racial inequity. And that by itself would stop us from enacting things that cause problems, instead of waiting several years after those problems have emerged and saying, hey, look at all this damage this did. Maybe we can reverse that now. And so those are the kinds of things that this office would do. I would leave it independent. I think that there's a lot of experts that have had conversations about this. The goal is to have a hearing on this, to have folks sit down and talk about who really should be participating in this, and what communities we should be pulling from, and what colleges and universities we should be pulling from, and how to do that in a way that's accurate and also effective.
I don't want to be a negative nanny, but in a much smaller context, I take what you just said, and it reminds me of the model that was set up by Massport, which, is tied to the Omni Hotel deal. And, the people are very excited about it. They got the kind of involvement of folks of color in a way that had never happened before. And again, it was supposed to be a model for other departments, and yet it has not been. As far as I know, it began and ended with the Omni Hotel deal. So, how do you make it so that it's multidimensional and doesn't sort of die after one project, if you will?
So I'm unfortunately not familiar with that. And so I'll look into that particularly as an example of how not to do something, if that's how that worked out. But from the perspective of how you do this, you have to secure its funding. You have to make sure that it has the people funded to actually do the work that we're asking them to do. I think that's an easy fight, in the sense that, right now when we're talking about coronavirus and how it impacts budgets, the reality is racial inequity is wildly expensive. It's not a good policy. It doesn't save money to create racial inequity. It doesn't save us money to enforce them and keep that happening. It's actually wildly expensive, both in human cost and in economic cost. And so there's a way to do that. But I think you have to create independence. You have to make it so that the administration, regardless of who that may be, is unable to really tamper with what comes out of that office, or to really force their hand by cutting their funding or being responsible for their funding. And so there's ways to do that. I know the Congressional Budget Office has done its work effectively for quite some time. They're not partisan. They just create this is what we're looking at. We're looking at how much the spending is. We're looking at how much this affects the budget. And then what the politicians do with that, they do with that. But we make that public. And so you know that if there's a tax cut coming, this is what it does to the deficit. If we're doing some kind of spending, this is what it does to the deficit. And so it's the same idea, but if you replace deficit with racial inequity. And so I think there's a world where we could do that, where it's public facing. I believe at the end of the day, politicians are responsible to their constituents. They're frankly responsible to public opinion. And when things come out and something raises racial inequity, it's incredibly difficult for me to envision an elected official in the city of Boston who would say, you know, that's a good idea, let's do that publicly on something that's publicly doing that. And so I think this is a real deterrent. My hope would be that this would operate better than the example that you gave.
Dr. James, you all, when you back to your talking about root causes, over at Boston Medical Center, you actually are addressing root causes in a real concrete way. You've got some housing, you've set up a food program, because you identified some of those as factors that were obviously impacting the health outcomes. I think it's still so tough for people to realize that all of the causes you all have mentioned that don't seem to be health related are health related.
Well, so I didn't hear the last thing you said.
I said I think it's very hard for people to understand when all of the factors that many of you mentioned tonight that don't seem to be health related are health related.
Sure. So I can just give you an example of what that looks like to make the correlation. So if you are coming from a community that has been traditionally and historically disinvested in, you will more than likely be working in jobs that limit your income, for example. So you will have limited resources. And on a daily basis, you're making hard decisions about what you do with your limited resources, how you allocate that. Do you use your limited resources to pay rent, to buy food for your family, to pay for utilities, or do you use those limited resources for a prescription or for a copay for a medical appointment or even for transportation to a medical appointment? And for these patients, it's an easy decision because health and healthcare will always rank secondary to survival. But not being able to, and also not being able to have access to healthy, affordable food, not having green walking space, where you live. When you don't have those things, your health is going to, it's going to take second place, and you're not going to do well. You're not going to thrive. You're not going to be able to eat well to manage your diabetes or your hypertension. You're not going to be able to exercise. I mean, you're not going to have time for that. You have a job that may not even allow you to have sick time or time to take off to go to a medical appointment. And so what happens is your health goes by the wayside. And the way it shows up is people wind up coming in here perpetually unstable, in their health status. And you, again, like I was saying earlier, you basically are just going to reset them back to baseline, and then you're going to discharge them back to exactly what's driving it. And so we know, we know these things. So we have, as you stated, attempted to focus on root cause to disrupt these structural barriers that have been created and are driving these outcomes.
So tell me more specifically about the partnerships that you have around housing and the food exchange, or I guess it's a food support system for people who don't have access to either of those in ways that other people might.
Well, just two quick examples. First of all, internally, we have a prescription-based food pantry, which I'm told is the first one in the country, connected to a hospital. So doctors can write prescriptions for that. And even with that, the root cause of that is, you have to think, what's the root cause? We can give you that subsidy, but what's driving it so that you don't need that subsidy? But just as an example, in Massachusetts, when a hospital builds onto its facility or builds a new facility, the state says we have to commit 5% of the total cost of that construction to the community. And so we did a campus redesign about 3 years ago, and for the first time, we asked the state if we could commit our obligation to different types of housing initiatives. And the state approved it. And just as an example, I'll present what we did with one thing we did. We invested in a private equity fund. And specifically, this equity fund was because it will only fund developments that provide access to affordable housing, employment, green walking space, transit, and healthy, affordable food. And our contribution contributed to what is now becoming 323 units of new mixed income housing, some to own, some to rent. The people in the community wanted a grocery store in that space. We were able to locate a grocery store that is in Washington, D.C., actually, but it it shares our values. And we were able to help that grocery store mitigate the cost of expansion by giving it a no interest loan. And there are other partners we worked, with in getting this entire thing done. And honestly, optically, when they had the ribbon cutting last August, if you were to see the laborers, the electricians, the plumbers, the masons, all those people there on that site, 70% of them come from the community. So that's just like one example of, what we're doing. And we belong to something called the Healthcare Anchor Network, which focuses on increasing more economic mobility in communities by hospitals being intentional about how they make everyday decisions in hiring, investment, and procurement. And there are other healthcare systems in Boston who belong to that network as well. And we're actually collaborating on some housing stuff, for example, and some other things going forward as well.
Okay. Sean Parikh, there's just been a whole lot of bad news with regard to indigenous populations and COVID. I'm thinking about the Navajo Nation has just been ravaged by the disease. But I wonder if there's any place that there are some best practices happening now that you would like to see amplified in the way that Dr. James has come up with one kind of solution, and Councilman Arroyo is thinking long terms about what could be a solution. Are there best practices somewhere that, if they were extrapolated from an indigenous community, could be overwhelmingly helpful in this moment and beyond?
Yeah, so I think that what's really critical to look at, we currently participate in a coalition that advocates for the Massachusetts Indigenous Legislative Agenda. And we talk about issues of racism against Indigenous peoples, and we communicate it in such a way that we define it as a public health crisis. And, in the advocacy of these bills, banning Native mascots, changing the state flag and seal, that the flag and seal bill is something that was championed by former Representative Byron Rushing for over 35 years. So we've been talking about how those issues are not just about representation, but how those affect the public health of the people. But, one thing that we've also found in that advocacy experience is that there are other bills that address, from a policy perspective, perhaps like data equity, decarceration rates. And one thing that's a barrier to us to actually participate in advocating for these bills as well is that these bills don't actually have the 4 critical words and Indigenous people too. Since we're not included, it's very hard for us to go in and then say, okay, well, yes, we support it on the hopes that this piece of legislation, that this policy will be retroactive or amended before passage, so that we are included. So we have to constantly talk about the need to address racism against our community, talking about how it creates a public health crisis. But this country is based upon, and as many nation states are, based upon divestment from Indigenous peoples. So, when we talk about, having these types of initiatives, which brought up about, the Omni Hotel, it is very critical for us to consider the source of the funding and what's sort of behind this, because if it comes from a private developer, then it's issues of land, extraction of resources, desecration of graves, all things that we have experienced and we've been trying to push back against, not just NACOB, but tribes nationwide. So, and on top of all of this, we have to keep our community members healthy and safe. So it's a lot. It's a lot to deal with on a daily basis.
So, but if I hear you, the central issue is to stop the erasure, the invisibility, so that if your community is present, then you can be involved in both solution building and also naming, as Councilman Arroyo said, racism as it happens.
Yes, absolutely, absolutely. We need, we need to be a part of these discussions.
Okay.
And, for some reason, even when our community members are part of these discussions, it's very hard to get those 4 critical words in those bills and those policies.
Well, I thank you all for a very insightful conversation. These days are tough, but I thank you for taking the time to talk to us, and stay safe.
Thank you. You too. Thank you.